Healthcare providers have an important responsibility to not only provide services, but education to teenagers about sexual health. Now, ideally, teenagers should be getting information around sexual health from multiple sources, from schools, from families, from trusted adults. Even though they should be getting this information in multiple ways, they're not always. And that's why it's important for healthcare providers to make sure they provide that information as well. Sexual health isn't just about teen pregnancy, because we know, even though that historically Oklahoma has had a really high teen birth rate, there's so much more than that. It's about prevention of sexually transmitted diseases, having consensual, safe relationships and safe sex. It's also about, being satisfied in your sexual relationship. Parents are reluctant to start their kids on birth control because there's this sense that if you give kids birth control, they're going to be sexually active. And in fact, that's not true. What the data shows is that, teenagers are going to do what they're going to do. And I describe birth control a little bit like, it's just there in case you need it. And ultimately, at the end of the day, what we want for our kids is for them to be safe, and we want them to be healthy. And having teenagers have access to birth control gives them, and having them on birth control gives them that opportunity. The majority of sexual health education really puts the burden on women to take all of the reproductive responsibility. And I think this is largely a societal problem because, men really have a role in sexual health as well. And so it's important for both men and women to learn about sexual health, to take responsibility for their sexual health, and to really be engaged when they are in relationships together and take charge and take power. Having conversations with teenagers about what their goals are is really important, and being able to help empower them with knowledge and the tools that they need to make healthy choices to help them reach those goals. And what's important is that we connect them with the resources they need in order to be healthy. I find what I do really fulfilling because it is oftentimes a topic that is neglected in medicine, that people may feel uncomfortable talking about it, but can have a really big impact for teenagers and for the rest of their lives. And so it's really a privilege to be able to work with teenagers and their families talking about sexual health and making sure that they get the information and the medical care they needed. Healthcare providers and other people who work with teens need to be really knowledgeable of all of the resources in the community that they can help teenagers who reach out to them for help. And so Thrive is actually a really great resource because it connects, individuals with all of the different resources that are available in the Oklahoma community. What I've seen in my time here is the power of people working together for a shared goal and a shared vision to help improve teen health. We've been able to make a tremendous difference in a short amount of time to really radically impact the health of teenagers, but also their health in the future. And so that's why it's really important that we all are working together, and that's why I think Thrive is so powerful in this mission. As a healthcare provider, I can start the discussion with patients and their families about the importance of sexual health. What can you do as a healthcare provider to help facilitate the discussion around sexual health with youth?